We're here basically to make it more apparent what's going on in terms of cuts to registered nurses. I don't think people actually know, and they need to know that skilled professionals are being replaced with unskilled, unregulated workers, and it's going to make a huge impact on the healthcare system in the future.
We want the public just to be aware that we will and are advocating on their behalf for what we see as a potential patient safety risk by the number of nurses that they are proposing to implement in their new models of care.
They call it the workforce transformation, and what they're doing is trading or decreasing the RN ratio and bringing in healthcare aides, which is an unregulated body, and they have 6 weeks training, whereas the RNs have 4 years or a lot of experience.
The changes that are happening in the hospitals are affecting patient safety, and they're affecting the safety for everybody, and it's affecting the care that we can provide for the patients that we care for. I am a nurse from the University of Alberta who was recently laid off, and I'm out here supporting other nurses and letting the public know that we are disappearing. But what we're doing is we're going to get dressed in white, and we're going to be proud to have our registered nurses pins, and we're going to be telling everybody who we are and why we're there, and that we're registered nurses and we're there to take care of them.
I strongly encourage nurses from across Alberta and Canada to really think about how we are seen in the public eye in our work sites. And I think it's really important that we look at somehow displaying that very visually, and I think wearing white is a fantastic way to bring back the role of nurses to the forefront.
Well, the Wear the White campaign is important because it helps us to stand out among our allies in healthcare. People don't realize how few nurses there are actually on the floor, and by wearing the white on Wednesdays, we are clearly identified and clearly seen as nurses. Who's a nurse, who's a healthcare aide, who's something else, not a nurse. And so, you know, we are here so we can be easily seen and identified by our patients and the public at large.
It's important that the public is aware that already there is a shortage of registered nurses at the bedside doing care, and it's important that in order to provide safe patient care that we have a registered nurse at the bedside.